I'm joined in the studio today by Dr. Alma Cili, who is a hematologist at Nena Teresa University Hospital. A hematologist, for those who don't know, is someone who specializes in blood. Alma, welcome to the show. First, before we get into all of the topics we want to discuss, can you introduce yourself?
Absolutely.
What exactly is it you do? What's a day in your life like?
Okay, I'm a hematologist at the University Hospital Center Mother Teresa, the hematology clinic. I've been there since 2008. For 1 year and a half, I was a volunteer, and in our clinic, we treat cancer daily. We are a unique center in Albania, so there are a lot of patients, a lot of work. So my day from 8 a.m. till 2 p.m., which are our official hours, is quite full.
And what do you do during that time as a hematologist?
As a hematologist, okay, we do rounds on patients. There are a lot of patients, or I would say like 98% of our patients need chemotherapy, so we do write prescriptions for protocols. We take vital signs, and of course we ask for, there are certain patients that need blood transfusions. There are some of them that need platelet transfusions, which we call supportive therapy. So, but mostly we are there for the patient all day if they need us and stuff like that. It's not just us, it's our lovely residents, our lovely nurses that do a great job every day.
So as a hematologist, what conditions impact sort of the blood and require transfusions or treatment, platelets, plasma, etc.?
There are a lot of cancers, hematological cancers that need blood products or blood transfusions. But of course, there are certain anemias that are hereditary, like sickle cell disease or thalassemias, that need blood transfusions, and they need it if they are if they are the major form. Let's say thalassemias, they need it like every 21 days, and some of them even sooner than that. So there are a lot of solid cancers in other clinics as well, but in our clinic it's mostly hematological cancers that need blood transfusions or platelet transfusions and stuff like that.
So hematological cancer is like leukemia?
Yeah, like leukemias and lymphomas and chronic leukemias, acute leukemias especially. We need a lot of blood transfusions on them because of the conditions they are, and it's an acute form, and people need support. So
how many patients are you treating with these chronic diseases? So the various diseases you've mentioned, people who require regular treatment.
Okay, well, I can't give you a certain number. I can only tell you that like in a day in our clinic, there are about 80 patients, and that does include our ambulatory clinic. So we have part of them are hospitalized. Acute leukemias are in general hospitalized because they need a lot of care. But there are a lot of cancer patients, like chronic cancers, like let's say lymphoma or chronic lymphocytic leukemias, that they come to our clinic every like 3 or 4 weeks, and they do the chemotherapy protocol, and they can go back to their homes because their conditions are quite well.
Yeah, they don't need inpatient.
No, they don't need inpatient. Sometimes they do if they develop like certain infections, but mostly they are treated in our ambulatory clinic.
It sounds, it must be quite tough work working with people who have these very serious chronic conditions, even aside from the condition itself, I have people in the past who I've known who've had leukemia very young, in fact, and it's very difficult disease, but not just that, but the treatment. So the chemotherapy has its own range of side effects as well.
Of course.
This must be quite difficult work for you, seeing the impact it has on people, dealing with families who are emotional, who are scared.
Yeah, we do the psychologists, we do the doctors, sometimes we have to do the nurses, we do the friends and everything.
The shoulder to cry on.
Yes. We are just there for our patients daily. So
now I want to talk about blood transfusion. I'm from the UK and I've lived in Europe in the EU for 10 years. And I was never allowed to donate blood in the EU because as a British, someone who was in the UK, during a certain time when we had BSE, it was a disease, a blood disease in cows. And anyone who's thought to have eaten meat during this period is not allowed to donate blood in the EU.
Okay,
so I was never allowed to donate blood, and I always wanted to because I have the universal blood group. So it's useful to people, But in Albania, they accept my blood. I don't have this condition, but because I was born during this period, they
were
don't
just
let me in Europe.
scared to
Yeah,
take your
but
blood.
I don't have it. And in Albania, they let me donate my blood. So I go twice a year.
That's wonderful.
I'd go more if they let me, but they said I'm not allowed to.
Yeah.
So twice a year is how often I go. And when I
wonderful.
say this to people, sometimes they're a bit surprised. Even the people in the blood donation clinic are a bit like, they're like, who are you here for? I'm like, no, I'm just, I'm just here to donate. And it's a different culture, I think, to perhaps the UK and other countries in Europe where people often voluntarily go and donate regularly. It's just something you do.
Yeah.
Here, it doesn't seem to be quite so popular in that respect. Is that correct?
Yeah, you are correct. First of all, let me congratulate you. It's a great act. I mean, your blood serves to a lot of people, and it's the most performed procedure, as we mentioned earlier, in the hospitals. And there are a lot of conditions that need, like from accidents to solid cancers or hematological cancers or chronic anemias or acute anemias like blood loss from the GI tract and all that. But yeah, it is not very popular that Albanians go and donate blood. Actually, I want to make a call. Everyone can donate blood every 3 months. Of course, that blood is tested for a lot of infections like hepatitis B, hepatitis C, and HIV, and of course syphilis. There are a lot of conditions that can't donate blood, but there are certainly a lot of people out there who can donate blood. In Albania, there are about 13 people in 1,000 inhabitants that donate. The aim is to make the number 20, so we don't have to have family donators. Let's say you need a surgery, your family members have to go, it's mandatory, and donate blood. But let's make that number like volunteers totally.
Yes.
There are a lot of institutions who do it, like public institutions. I want to, congratulate them. It's a great act. But there are a lot of people out there that are kind of scared to donate blood. Nothing happens to you.
The mentality, there's this,
Yeah, I
this
know.
also conspiracy sort of, oh, they're going to sell the blood on the black market, or it won't go to the person it's supposed to. What do you say to these people?
Okay, no. Let's just, let's just not think about this. That your blood goes directly to the central blood bank, which is in La Praca area by the hospital there. But it gets tested and all that, and with all the tests, it does. They do get the ABO group as well, and it goes to the persons that need it for sure.
And everything had serial numbers and
Yes,
codes,
definitely.
and it's
Yeah,
all
yeah,
recorded.
Yeah.
And
it is
actually,
definitely recorded.
you then get a full blood work afterwards.
Yes,
You get to know. I mean, I don't know what it means, but I send it to my doctor, and he says very good.
Yeah.
So this is part of it as well. When you donate, you get something back
Absolutely.
as well.
You get tested for these conditions, as I mentioned, HIV, hepatitis B, and C, and syphilis. And if you would get tested somewhere in a private clinic, you'd pay for it.
Yes.
So why don't you just donate blood and get tested for
But
free?
it gives you the general blood workout as well, so
Absolutely.
you know if you're in general good health and everything, not just for diseases. So this is because I want to appeal to expats, foreigners, immigrants who are living here to go and do it as well. I did a campaign about 4 years ago now with the president at the time, Ilia Meta. We brought expats from Durrës, Saranda and Tirana to donate blood, and we had lots of them all donating blood. But I want to encourage them to go back again as well. So basically from you again, can you just reassure people that it doesn't hurt, there's nothing to worry about, the blood goes to those who need it?
Yeah, it's just a little prick. It just hurts just a bit, as if you were doing some, blood work, general blood work or general testing. So, and then of course, I would make a call to all the public institutions. They are the ones actually that regularly donate blood. The central blood bank, they do go in different institutions and they collect blood, which is a great act. But you save lives with that blood. You have to think one day, God forbid, we may need that blood. And there is another condition which is called autologous blood transfusion, which means you donate the blood and then in the future you can use it, just in case, God forbid, you need it. So, but it's usually allogenic. So there's a different person out there that gets tested and then you get your the same exact blood and same exact rhesus group. But everyone can donate. Everyone can save lives. It's just one of those beautiful things that anyone can do in life.
It's such a small act
Yes,
to do,
and
isn't
and
it?
it doesn't take a long time, as you mentioned, like just 20 minutes. Anyone can do that.
And are there side effects?
No, you may feel a little bit dizzy afterwards. We encourage them to take a lot of fluids and all that, and maybe, let's say, people that are into sport and all that, they can just postpone it for a few days, but
Yes.
nothing special.
And I was told don't drink alcohol
Yes,
afterwards as well.
yes, yeah, because it
Don't
does
smoke,
dilate your
yeah.
blood vessels and
Yes.
can lower your blood
Yeah.
pressure.
Where can people donate? Is it just at Nena Teresa Hospital, or are there other?
It's at Mother Teresa University Hospital, at the blood bank we have there, or people can go in any blood bank in all the regional hospitals, or a lot of people donate at the Central Blood Bank, which is in La Praca. So anyone can donate. Anyone, any age, any adult can do that. So
So anyone over 18?
anyone over 18, anyone who knows that they don't have infectious disease, that let's say they are carriers of hepatitis or HIV, but at the end they still get tested. I mean,
Yes.
but if you know that you are a carrier, you cannot go and donate because
no.
that blood will be thrown away.
Yes.
They can't use it if you have, let's say, hepatitis or B or C or HIV or syphilis. That the blood will go nowhere, so you don't really
Yes.
need to donate it.
And also, if you're anemic, you can't, or you have low
No,
blood
you
iron.
can't. No, you can't donate blood if you're anemic.
I want to just talk again, because I think it's important, just another sort of question about the stigma around donating blood, and for people to understand exactly how much difference their packet of blood can make for somebody. Spell it
A
out.
huge difference. Let's imagine someone who had like an accident and they had a lot of blood loss and they need blood immediately. You can save lives, trust me. Because sometimes them shelves get empty because the donators, especially during COVID times, people would not go out and people, the level of donations really dropped. But nowadays we are improving, but we are not still at the level. As I talk to the people of the blood bank, we are not where we are supposed to be. So public institutions are the ones that make a huge difference, except general people.
What is the level of blood at the in Albania, that we have in stock? How high should it be? I mean, how short are you running?
We can fulfill the need in our clinic. Sometimes we tell the patient's family members to go and donate. Sometimes we have students who are offered as soon as they listen in the clinic that this patient needs blood or it's a rare type, like let's say AB rhesus negative is quite rare. They just go and donate. So I can't tell you exactly if they are short. I just know that the numbers are they are supposed to.
Yeah.
Like from 13 in 1,000, they should be like 20 in 1,000.
Thank you so much, and thank you for the good work that you do.
Oh, thank you very much. It's been a real pleasure.